Hello everyone. We will discuss the following topics in this video. Introduction. Types of joints. Structure of normal knee joint. Functions of a knee joint. Osteoarthritis definition. Structural changes in arthritic joint. Comparison. Symptoms. Conclusion. Introduction to joints. The knee joint is one of the largest and most complex joints in our body. It is made up of three bones: the femur, thigh bone, the tibia, shin bone, and the patella, kneecap. These bones are held together by ligaments, tendons, and cartilage to provide stability and enable a wide range of movement. It allows us to walk, run, sit, and climb stairs. But when degeneration sets in, this normal movement becomes painful and restricted. Based on structure and movement, joints are divided into three main types. Fibrous joints, where bones are joined tightly by connective tissue and show no movement, like the skull sutures. Cartilaginous joints, connected by cartilage, allowing limited movement, like the intervertebral discs. Synovial joints, the most mobile type, having a joint cavity filled with synovial fluid. Let's now look at the structure of a typical synovial joint. It consists of articular cartilage, a smooth covering on the bone ends that reduces friction. The synovial membrane lines the capsule and produces synovial fluid for lubrication. The joint capsule encloses and protects the joint. Ligaments connect bone to bone and provide stability. Synovial fluid, viscous, clear fluid that nourishes cartilage and provides lubrication for smooth movement. Muscles and tendons around the joint help control movement and maintain dynamic support. All these components work together to provide smooth, pain-free motion. Let's now look at the structure of a typical synovial joint. It consists of articular cartilage, a smooth covering on the bone ends that reduces friction. The synovial membrane lines the capsule and produces synovial fluid for lubrication. The joint capsule encloses and protects the joint. Ligaments connect bone to bone and provide stability. Synovial fluid, viscous, clear fluid that nourishes cartilage and provides lubrication for smooth movement. Muscles and tendons around the joint help control movement and maintain dynamic support. All these components work together to provide smooth, pain-free motion. A normal joint performs several important functions. It allows smooth, painless movement, provides stability, and distributes load evenly. It also acts as a shock absorber during weight-bearing and maintains proper alignment and posture. Any damage to one of its structures, like cartilage or ligaments, can disturb these functions and cause pain or restriction. Osteoarthritis is degenerative joint disease. It occurs due to gradual wear and tear of the joint cartilage. It usually affects weight-bearing joints like the knees, hips, and spine. Cartilage wear and tear, the smooth cartilage covering the bone ends becomes thin and rough. Joint space narrowing, the space between the bones decreases as cartilage is lost. Bone spur, osteophyte, formation, new bony growths develop around the joint edges. Subchondral bone hardening, sclerosis, the bone under the cartilage becomes thick and dense. Subchondral cysts, small fluid-filled sacs form inside the bone near the joint. Synovial membrane thickening, the lining of the joint becomes inflamed and swollen. Joint deformity, abnormal alignment such as bow legs, varus, or knock knees, valgus, may develop. Let's compare the two conditions side by side. In a normal joint, cartilage is smooth and intact, the capsule is elastic, and movement is painless. In an arthritic joint, the cartilage is rough and thinned, the capsule becomes thick, bone ends may form spurs, and movement becomes painful and restricted. Over time, this can lead to visible deformity. The common symptoms of knee osteoarthritis are joint pain, especially after activity, stiffness after rest or in the morning, swelling around the joint, a crackling sound called crepitus, restricted movement and deformity, muscle weakness and instability, difficulty climbing stairs or squatting. These symptoms gradually worsen if not managed properly. To conclude, osteoarthritis of the knee is a degenerative joint disorder that leads to pain, stiffness, and functional limitation. The main cause is wear and tear of articular cartilage with age, overuse, or injury. Understanding the normal structure of the knee helps us appreciate how degeneration affects movement. Early recognition of symptoms and physiotherapy intervention play a vital role in controlling pain, maintaining function, and preventing disability. Thank you.